If you're a nursing student, you know a nursing student, or you're the parent of a nursing student, please stop and listen. There's some new information that just came out about the nursing licensure exam, and I'm about to tell you all about it. I'm Marlene Hurst, president of Hurst Review Services. And during this time of COVID-19, I want to make sure nursing students across the country and Canada stay up to date on their NCLEX exam and any changes that could occur. Now, the information relates to RNs and PN students. The changes I'm about to review will be applicable until July 2020. And after that, we hope everything returns to normal. But until that time, we just won't know. So here we go. Number 1, the testing centers will reopen March 25th. Number 2, your time will be decreased. Why? Because they want to limit exposure, but they also want to be able to schedule as many students as they possibly can. So now you will have 4 hours to take your exam instead of 6. Well, this concerns me some because you're losing 2 hours of cushion just in case you happen to need more time to complete the exam. Most students need about 2.5 hours to complete the exam. Number 3, in the past, RN students could have anywhere from 75 to 265 questions. As far as the LPN, it's 85 to 205 questions. That's changed. Now, all of you will have a minimum of 60 questions to a maximum of 130, 60 to 130. Most students take around 123 questions. Now, the average length of the test is almost the whole test. Also, let me say that all of our readiness tests are 125 questions apiece because we want you to feel what it's going to feel like when you go and take your actual NCLEX exam. Now, let's stop and think about all this for a second. Normally, on the exam, you would have a maximum of 265 questions. They have found with the maximum of 265 questions that they can determine within 95% accuracy whether someone is going to pass or fail. Okay? Now, if they wanted to be 100% sure, they would have to have a lot more questions than 265. They would have to have 1,000 plus. It would be impossible to take that many questions, wouldn't it? But think about this. If it takes more questions to accurately predict whether you should pass or fail, it stands to reason that less questions would be less accurate in predicting whether someone should pass or fail the exam. And another reason I have concerns about you having less questions and less time is the fact that you are losing some cushion, like I mentioned earlier. You don't have as much time to settle down when you get into the test and settle your nerves. Many students have told me they had an out-of-body experience until they got to question 14, and then they were able to settle down after that. Something else you need to know is there will be no pilot questions on this exam, and there will not be any of the next-gen research questions that you may or may not have heard about. Every single question on your test will be graded. Now, I want to make one thing clear. I do not tell you all these things to scare you. I've been teaching nursing students for 32 years, and I've never had to resort to scare tactics, and I'm not going to do that now. I'm just a realist. I want you to know ahead of time what the changes are so you can be prepared for those changes when you go into that exam. There has never been a more important time for you to pass the first time than now. There has never been a more important time for you to understand your information from a clinical perspective than now. Okay? We start our review by going over must-know clinical content. All right? This information is very important. Now, I know many of you want to or would prefer to take just a bunch of questions to practice. Okay? That's just more fun, isn't it? Well, it may not be the right way to go at this point in time. And also, the majority of the questions that are out there are single topic. For instance, you may get a question about hypothyroidism, okay? Well, that's a single topic. The questions on NCLEX are not going to be single topic. They are going to require multi-logical thinking. That hypothyroid question, if you miss it, then you're going to have to read a big rationale and understand it. Do you really want to start teaching yourself again right now? I don't think now's the time for that. Let me ask you this. Do you want to just get by at this point in your career, or do you really want to think like a nurse? I think you want to learn how to think like a nurse. I know you have a lot of that skill right now, but it can be improved. Do you want to be able to think on your feet? Do you want to know what questions to ask in different situations? And do you want to know when your patient has gotten out of your scope of practice? We can help you with all of those things, every single one of them. If you complete our review like we tell you to, and then believe me, it is outlined to a T, you will pass the first time. You don't need to worry about NCLEX. Believe me, we've done that for you. All you have to do is go to hurstreview.com and select the review you would like and get started. We are, like I said earlier, we are streaming live reviews every day to hundreds and hundreds of students. Now remember something else, and I know you know this, but I want to review this. You know the test is a safety test. In just the first few pages of our book, look at all these little green tabs. You're familiar with those little green fluorescent tabs, aren't you? Just in the first few pages, look how many safety issues we have. All right? There are hundreds more of those within our book. You know, we all hope that COVID-19 will hurry up and just disappear and things can get back to normal. And we can go back to teaching our live reviews across the country and in Canada just like we've always done. But until then, we've got you covered. Our pass rate for first-time test takers is 98%. Now, National Council tells us that for repeat test takers, in other words, someone that was not successful on their first exam, their pass rate is 42%. That's a significant drop, isn't it? And I also want you to know that our pass rate is validated by an independent testing solutions company based on 40,000 students at least. We didn't just make up that pass rate one day. It's been validated. When you complete our program, you will have everything that you need to pass. You will not have a doubt in your mind about what you're supposed to do to study when you leave our program. Our course is not about knowing more and more and more information. It's about taking what you do know and being able to apply it to things you have never heard of before. Because yes, you could get questions on topics that you've never heard of before. We're going to show you how to deal with those questions. Come on and join in and pass the first time so you can go ahead and pay for that car that you've already got picked out. Now stay safe and thanks for listening.